We are live now.
Okay.
Uh, yeah. So good morning, everyone. Today's 8th March. To all the participants, Happy International Women's Day. I'm Dr. Hita Patel from IAP Digital Media Team. I'll be host for the today's webinar, which is on prevention of cervical cancer, a guide to protection and early detection. The resource person is Dr. Neha Sharik ma'am, and she is a senior gynecologist. It is being organized by the IAPWC Madhubani district. The Indian Association of Physiotherapists is the oldest and largest association representing physiotherapists in India since 1955. The IAP digital media team consists of a group of physios who handle Zoom platform, webinar live streaming, and IAP profiles on social media platforms Facebook, Instagram, Twitter, LinkedIn, YouTube. Follow the IAP profile on this social media to receive notification for our events such as webinars, workshops, CMEs, conferences, health camps, blood donation drive, and to know about recent updates on physiotherapy. Subscribe to IAP YouTube channel for notification of our live webinars in the playlist section of this channel. The social media link will be shared in the chat shortly. Uh, for the today's webinar, the coordinator is Dr. Archana Pathak, who is an IPWC Madhubani district coordinator. So over to you, ma'am.
Good morning. Good afternoon, everyone. Today, on occasion of International Women's Day, we are organized to raise awareness about cervical cancer in women worldwide. So, especially in places where screening is less available. So, today it is my privilege to introduce my senior gynecologist based in Mumbai to talk about it. Over, and I'm the coordinator of Madhwani district team. So, ma'am, it's over to you, Dr. Nehal Sarik, ma'am.
Yeah. Hello. Good afternoon, everyone. एंड एट द आउटसेट मैं आप सबको विश करना चाहूँगी अंतर्राष्ट्रीय महिला दिवस की हार्दिक शुभकामनाएं सबको. And today we have a topic is to discuss is prevention of cervical cancer and vaccine. So let me just briefly introduce myself. I, Dr. Nehal Sharek, I'm practicing obstetrician and gynec since past 25 years. I have done my graduation from Dr. D.Y. Patil Medical College and then my post graduation from KEM Hospital. And after that, I've been into private practice since past 25 years. And in this past 25 years, what I have noted also that women don't take care of themselves. And prevention, I mean, that is the least thing what a woman, the thing comes to a woman's mind, to go to a doctor. They don't go unless there are symptoms in our country. So just wanted to highlight on this that about and talk about cervical cancer. As we have a vision and commitment that Swasth Nari Sashakt Parivar. So let us begin with our session. Uh, so first of all, I would like to discuss about what exactly is a cervical cancer. Like everybody knows what is a cervix, but still briefly, I would like to tell you that cervix is the lowermost part of the uterus, which connects to the upper body of the uterus and down into the vagina. Um, Now, why are we so much concerned about this cervical cancer? Cervix basically plays a very important role in childbirth, during labor, and it's a very important part of our body. But since it is not visible to us, so many people ignore the symptoms associated with it because it is not directly seen to us. That is the reason most of the cervical cancer, when detected, they are at a later stage. And then it causes a lot of morbidity and mortality in women. And the best part of cervical cancer is that it is highly preventable when proper screening is done. So now talking about the causes of the cervical cancer. Cervical cancer is primarily caused by human papilloma virus. 95% of all the cervical cancers are caused by this. And everyone who has been sexually active has some or the other time exposed to this HPV virus. But in most women, this HPV virus, because of our immunity, it just the body gets rid of this virus and nothing happens to the woman. But in certain percentage of women, this virus remains in their cervical cell and causes the cell to undergo changes in the form of dysplasia and then into malignancy. Then there are certain other factors which um, pose a woman at a higher risk of having a cervical cancer are immunocompromised patients, diabetic patients, patients who have got HIV infection, and other sexually active, sexually transmitted diseases. They are also more prone for this cervical cancer. Also, smoking increases the vulnerability of the HPV related cancers. Now, briefly, I would like to talk about what are the signs and what are the symptoms of this cervical cancer. The first of all, very unusual discharge, white discharge, as you called as leukorrhea, or sometimes it may be a very foul-smelling vaginal discharge. If you have any of these symptoms, you must immediately go and see your gynec. Secondly, abnormal bleeding. The bleeding may be between the menstrual periods, in between, or after sexual intercourse, which is called as postcoital bleeding, or even in a postmenopausal woman. If there is a bleeding, they should immediately see a doctor. Then, in the later stages, when the cancer is in advanced stage, people can have other symptoms like some urinary symptoms like increased frequency, burning, then even lower backache, um, fullness in the pelvis down. These are the symptoms when the cancer is in an advanced stage. So, as I already said, why the cervical cancer is dangerous, it is because the cervix is inside the body and we don't see it. So we don't realize till it is in an advanced stage where it causes all these symptoms of bleeding or backache or foul smelling discharge and so forth and all. So it is important that you should have a routine gynec checkups by your doctor, because this cervical cancer is 100% preventable when it is done by a proper screening. Now, this disease is divided into almost three stages. One is a precancerous stage, then there is an early stage and a late stage. In a precancerous stage, where the symptoms may not be any evident, but the patient may be having silently suffering from it, when it's called as a dysplasia stage, where it can be detected by some very routine test. You can go to a doctor, which I'll be discussing further, and can be treated also on a OPD basis, very simple to treat, and 100% treatment is available. Then in the early stages, most of the time we need to do a hysterectomy with removal of the ovaries. So it's a surgical uh, method. And then in the later stages, radio and chemotherapy is required, okay, which causes a lot of morbidity, as you all know. So now, I would like to briefly, this was the treatment approach. Now, what is the basically, how can you prevent this cancer? Now, first of all, I would like to highlight that we should do a regular screening. So, what is meant by regular screening? There is a simple test which is available, which is called as a pap smear. First of all, every lady who is in the age group, I would like to say from 21 to 29, who is sexually active needs to do this pap smear test every 3 years. And then about 30 to 65, depending, every 3 to 5 years, if they have something in their pep test where earlier it has been detected that they have some dysplastic cells, then they need to go to the doctor as advised by the doctor frequently. Maybe within a year, within a 2 year, the pap test may have to be repeated. So, and pap test, not only a simple pap test, but it should be done along with an HPV testing, which is now widely available. So, where they detect the HPV virus in the cervical cells. So, if you have an HPV positive in the cervical smear, this pap smear test, then you are at a high risk of developing a cervical cancer later. So, you need to monitor yourself very strictly, okay, with the doctor. So it's as simple as it is shown in the screen. Here you can see that there's a brush, and it's a simple OPD procedure where a test is taken and you get a report within 3 to 4 days. So very economical, very convenient, and it should be done for all the women, uh, as I discussed. Now coming to uh, the gynecological checkup, I said, then the pap smear with the HPV testing. Now, what is HPV vaccination? Um, this cancer is almost 100% preventable because, as I said, that 95% of this cancer is caused by HPV virus. This HPV virus, you get an HPV virus even if you have a single partner. So it's not that you have a multiple partners to get this HPV virus. Okay. So how do you prevent this? By giving yourself or vaccinating against this HPV virus. And who should get this vaccination? Now, WHO recommends to vaccinate all the children, regardless of the sex, girls or boys, for this HPV vaccine. Now, what are the doses? Now, this was the pap smear I discussed, the slide. HPV. The doses in 9 to 14 years of age, there are two doses which are given in a gap of 1 month. And for the ages of 14 to 45 years, you need to take three doses. That is, one is at 0, then one is at 2 months, and the other is at 6 months. Now, why you should vaccinate boys? Now, the question comes that why boys? Because boys don't have cervix. No, but boys do have can get penile cancers, which are also caused by HPV. Also, by vaccinating boys, you are going to create a herd immunity, as you know that you will be passing a immune virus, from the male to the female partner. So reduces the transmission and will protect both the genders. So even boys should be vaccinated. Now, as I told you, in India, this accounts for about one third of all the global cervical cancer deaths, is because of this cervical cancer, and that is all because of poor screening, late diagnosis, and very, very low HPV vaccination rates. One in every five women they die of cervical cancer, and they are from India. So now there's a good news that I think just 1 week back, our Modi ji has launched a nationwide HPV vaccination program now, and it will be available free to all the girls who are of 14 years of age. The only one dose they'll be giving, because one dose also protects almost 93 to 95% of the cervical cancer. So they'll be giving free vaccination to all the female girls who are of 14 years of age. It will be free of cost, and this will be done in the next 3 months. It is a very simple. It will be provided at all the government hospitals, all the government medical colleges, small, even primary health centers, district hospitals. You just need to register yourself. There is a platform called as the UWIN digital platform where you need to register your children, or anybody you can register your female child who is 14 years of age. So they are just starting this vaccination program, and by 2030, there is a world this thing WHO wants to basically completely eradicate this cervical cancer by vaccinating each and every one. So I guess this was all I could discuss about this, but I'm open for any questions if you want to. It's a very simple injection which is given in the deltoid region, only one, and it has no side effects, very, very minimal side effects, and it is absolutely safe for everyone, for all the females. So anybody wants to question can ask me questions, I guess. Hello. Hello.
Anybody have questions? Any questions regarding this? They can ask. If anybody have questions, please ask. Otherwise,
Yes,
Dr. Ritika,
go-
she is the
yeah,
sub coordinator of Madhubani district team. Dr. Ritika, uh, uh, please
yes,
arise some questions.
yes, ma'am. My first question is, can lifestyle habits influence the risk of cervical cancer?
Can what? Can I?
क्या मैम
I can't.
कुछ कुछ लाइफस्टाइल हैबिट्स की वजह से सर्वाइकल कैंसर का रिस्क बढ़ता है क्या? लाइफस्टाइल हैबिट्स जो हमारे हैं.
I said smoking. Smoking is one of the cause which increases your risk of having cervical cancer. And nowadays, lifestyle means people, I mean, almost, I think every third person is diabetic, right? Which causes immunocompromisation. So that also increases the risk of having cervical cancer. Because once you have an HPV virus in you, if your immunity is not good, your body will not eradicate that virus, and it remains in the cervical cells, and then it progresses into cancer.
And one more
Okay.
question, ma'am. Pap
Yes,
smear test is done by professionals or by self?
it is done by professional. I said you need to go to a doctor, gynecologist, and pap smear is also done free in all the government hospitals. So you must get it done. And in our country, we don't go for prevention programs, but abroad, everywhere they have health checkups every year, where you can come to know any cancers. Actually, basically, we don't go for routine checkups in our country, but this should be done as a routine, as I said, every 3 years, and then depending upon what you have the reports, discuss with your doctor, and your doctor may suggest that you need to do every 3 years or every 5 years. It's a very simple test done on OPD basis. There is no admission, or there is nothing, you don't feel any discomfort. It's a very simple procedure.
And one more question, ma'am.
Hmm.
HPV vaccines कितने एज ग्रुप तक ले सकते हैं? सो वन ऑफ आवर
अभी तो 45 years तक बोला है. ओके, बिकॉज अबाउ 45 years दे हैव नॉट फाउंड कि कुछ बेनिफिट है उसका, because the vaccine is not able to convert into that antibodies at that age, because as your age advances, the body does not, the ability to convert it into antibody levels are not very great. So they have found till 45 it is very effective. So till 45 years, if you have, you must take it.
और कितना एज ग्रुप तक होना चाहिए?
एज ग्रुप 9 years से चालू कर सकते हो आप. From 9 years, 9 to 14 years, only 2 doses are required, because the capability of your body, as I said, to convert into antibody level is very high at that time. So only 2 doses are required, and after that, 3 doses are required. But WHO has also done studies. So in India, we are only going to give 1 dose. That 1 dose also gives you almost 95% protection.
और प्रेग्नेंट लेडी ले सकती हैं क्या?
No, pregnant lady cannot take. No, because it's a live virus, so you pregnant lady cannot take. But post delivery, you can take it. Once you deliver, then you can take it.
Okay. Any questions, Dr. Ritika?
And even boys should be vaccinated, huh?
Okay.
मैम आपने बहुत अच्छे से एक्सप्लेन किया है सारा, तो मेरा जो भी क्वेश्चन था मैम के एक्सप्लेनेशन में ही आंसर मुझे मिल गया है।
Hmm.
ओके, थैंक यू।
एंड मतलब सेक्सुअल एक्टिव होने से पहले ही हमें ये वैक्सीन लेना चाहिए। कई बार लोगों के मिथ्स होते हैं कि अरे अभी तो इसकी शादी भी नहीं हुई है, अभी तो इसका कुछ नहीं है, हमें क्यों वैक्सीन देना है? यू नो बट बिफोर शी इज एक्सपोज टू एचपीवी, यू नीड टू वैक्सीनेट हर और हिम व्हाटएवर। सो द आइडियल एज इज 9 to 14 years। तो जब हर एक बच्चे को हम सभी टीका देते हैं, राइट, वी वैक्सीनेट अगेंस्ट डीपीटी, ये वो, राइट फ्रॉम बर्थ वी कीप ऑन गिविंग टू आवर चिल्ड्रन। बट व्हाट वी आर नॉट डूइंग दिस बिकॉज ये हमारे नेशनल इम्यूनाइजेशन शेड्यूल में नहीं होता है, तो हम नहीं देते हैं अपने बच्चों को, लेकिन ये भी देना चाहिए। हम 10 साल तक सभी वैक्सीन देते रहते हैं, टाइफाइड दिया, हेपेटाइटिस ए दिया, बच्चों को, लेकिन दिस विल ऑल्सो सून, इट विल डेफिनेटली कम नाउ। दे हैव जस्ट स्टार्टेड दिस 10 days बैक, दे हैव इंट्रोड्यूस दिस इन आवर कंट्री, सो आई थिंक वो आएगा भी नेशनल इम्यूनाइजेशन शेड्यूल में भी अपने। So I think as doctors, you also should promote this to not only yourself but to every other female or lady you see with you। और 14 years की है तो आप रिकमेंड करो उनको जाने के लिए और
मैम, वन मोर
वैक्सीन लेने
क्वेश्चन।
के लिए।
बॉयज
यस।
बॉयज कितने एज ग्रुप तक ले सकते हैं?
बॉयज भी ले सकते हैं टिल 45 years, आई सेड ना, टिल 45, बिकॉज उसके बाद वो इम्यूनिटी उतना, मतलब वो कन्वर्ट नहीं होता है उतना। And already you are exposed also to HPV by the time, I guess, at the age of 45.
Again, anybody have any questions? Please ask. Ma'am is there.
और प्लेन पैप स्मीयर नहीं कराना है, यू मस्ट गो टू योर डॉक्टर, गायनेक, wherever you go, tell them that I want to do a pap smear with HPV, which is important. So you know whether you are having HPV or not. ये भी बहुत important है. Because if you are infected with HPV, then you need to screen much, faster and earlier every year. If you are not vaccinated, that is.
अगर हम लोग रेगुलर स्क्रीनिंग करवा रहे हैं तो उसमें पैप स्मीयर टेस्ट करवाएं या फिर एचपीवी टेस्ट? रेगुलर
दोनों
स्क्रीनिंग।
दोनों पैप स्मीयर विथ एचपीवी होता है।
ओके मैम।
वो पैप स्मीयर में ही एचपीवी होता है। ओके।
ओके मैम।
सिर्फ आपको बताना है डॉक्टर को कि आप कहीं पे भी हो कि मुझे पैप स्मीयर विथ एचपीवी करना है। तो जब वो पैप स्मीयर लेते हैं, जो सर्वाइकल सेल्स देखते हैं, तो उसमें वो लोग एचपीवी का पीसीआर करते हैं। जैसे कोविड में कैसे पीसीआर टेस्ट होता था कोविड वायरस का, तो वैसे वो सेल्स में देखते हैं कि एचपीवी इन्फेक्टेड सेल्स है या नहीं। तो प्लेन पैप स्मीयर का तो अभी कोई रोल है नहीं, मतलब यू कैन डू इट जहाँ पे फैसिलिटी नहीं है, बट पैप स्मीयर विद एचपीवी इज द बेस्ट।
मैम, वन मोर क्वेश्चन। वैक्सीन के पहले टेस्ट जरूरी है?
नो, नॉट रिक्वायर्ड। सी बिकॉज मैंने ये कहा ना कि अगर इन्फेक्शन हुआ भी है आपको, तो आपकी बॉडी उसको पास आउट कर देती है, बिकॉज अगर आपकी इम्यूनिटी स्ट्रांग है, मैंने कहा, जैसे हमें कॉमन कोल्ड होता है, राइट, तो नॉट एवरीबडी इज इन्फेक्टेड बाय कॉमन कोल्ड। जिसकी इम्यूनिटी अच्छी रहेगी तो वायरस अपने आप ही अंदर खत्म हो जाता है। तो वैसे ही एचपीवी में जिसमें इम्यूनिटी अच्छी रहेगी तो मे बी वो डिटेक्ट नहीं होगा, लेकिन वो बार बार अगर एचपीवी का हमें आता रहेगा इन्फेक्शन, so sometime your body may not be able to eliminate that virus. So regardless of whether you have or not, you should vaccinate yourself.
Again, anybody, any questions? Please ask. Madam is there. Please don't hesitate. Any questions you can ask. Somebody is writing.
Because these days, we should be like prevention, prevention, prevention. हमें उस पे जाना चाहिए and not on treatment. That is what we should practice as doctors, how to prevent certain things.
Yes, ma'am. And now the session is over. So, on behalf of IPWC Madhubani district team, Dr. Archana Pathak, Madhubani district sub coordinator, would like to propose vote of thanks to all the dignitaries out there. So, thank you, Dr. Nehal ma'am, the senior gynecologist, for interactive sessions for our joinees. A special mention to Dr. Sanjeev Jha sir, the president of IAP, and Dr. Ruchi Varsane ma'am, the national head of IAP Women's Cell. I would also like to thank Dr. Smita Singh ma'am, our journal head, and really grateful to IPWC Bihar State team, Dr. Josni Pandey ma'am, who is the Bihar State coordinator, for mentoring us in the best possible way, and all the state sub coordinators, including Dr. Purnima ma'am, for supporting us. I would like to thank all the participants for our well-being to represent response for this webinar. Also would like to thank our digital team of IPWC, Dr. Heta ma'am. Last but not the least, Dr. Archana Pathak, Madhubani District Sub-Coordinator, would like to thank my colleague, District Sub-Coordinator, for the effort to make this event successful. Thank you, one and all. Please do share your feedback about our webinar. So Google form is available on Zoom and YouTube. So anybody have any feedback? So please share with us. So thank you, Nihal ma'am, for
Uh,
coming.
Dr. Archana, thank you very much for providing me an opportunity where I could educate and I could give you some insight, to all our doctor friends, colleagues, and everyone on this cervical cancer. Thank you very much. And thank you, IAP, for giving me an opportunity. Thanks.
Thank you, ma'am. Thank you.
Thank you.
Heta ma'am.
Like